want to tell you about a new major health concern, and it is uterine cancer. According to the National Institutes of Health, the number of women dying from this cancer has been rising significantly since 2000. Science and health correspondent Lindsay Thies joins me now live from San Francisco with more on this new study and what they're learning about why this is going on. Hello, Lindsay.
Hi, good evening, Natalie. Well, uterine cancer, it's sometimes also referred to as womb cancer, endometrial cancer. It's all the same thing. And there are some types that are more aggressive than others. But the gist of it when we're talking about cancer is it stems either from the cells, the muscle, or other tissues that are inside a person's uterus. Now, these findings that are particularly troubling when you're talking about the increase, and this is really a significant study increase year over year, was looking at cases before the pandemic. And it found, these researchers from the NIH found, not only were women affected year after year, these cases rising, these death numbers rising, but that Black women are being disproportionately impacted at far higher rates.
More women are dying from uterine cancers each year. Scientists with the National Cancer Institute saw an increase in uterine cancer deaths by nearly 2% each year between 2010 and 2017. More aggressive non-endometrioid uterine cancer deaths increased by almost 3% each year. Black women face the harshest fatality rates. Shakia Allen was diagnosed with uterine cancer at 27. She had to battle just to get that diagnosis, and looking back, thinks it was because of her age and race.
They would tell me it was polycystic cyst disorder. They would tell me that it was a hormonal imbalance. They would tell me all kinds of different things instead of actually just doing the workups to find out exactly what it was.
Allen had surgery to remove her uterus in 2009. Because of lingering health issues, she's undergoing tests to see if she now has ovarian cancer.
I'm going to deal with the fact of whether I have ovarian issues. I have cysts or tumors that are popping up on my ovaries, and I just started seeing the oncologist again because they have to rule out ovarian cancer at this point.
Lead researcher Dr. Megan Clark told reporters one of the reasons for these rising uterine cancer death rates is aggressive non-endometrioid uterine cancers.
I think in general, uterine cancer has sort of been underappreciated because it's, been historically thought of as something we can easily treat with hysterectomy, and the survival is so great that we don't need to worry. But we see these rising rates of these aggressive cancers that make up, 20% of all uterine cancer cases, and now we see that incidence is translating to higher mortality.
The American Cancer Society says many factors are to blame. Cancer treatment costs are getting more expensive for the patient, and access to care and education is harder for patients of color.
There's important barriers, too, that are well-founded from historical missteps related to clinical studies in communities of color that still are present today in terms of their memory, and certainly concerns about them, which I think are very relevant.
Diagnosis for uterine cancers is difficult. Routine pap smears cannot detect it. Right now, experts say most uterine cancers aren't detected until a patient starts showing symptoms like unusual bleeding. Shakia Allen started the Uterine Cancer Awareness Network, connecting patients like her.
That's what keeps me going. Every day I wake up, I try to find other ways to try to make sure that women are informed.
And getting out that information, she says one of the things that is most surprising to women in her network is that when they were diagnosed, they didn't know that a pap smear doesn't catch this. So that's a big takeaway here. So when you're talking about those screenings, doctors run them usually after a patient starts to have those symptoms and their specific diagnostic tests. And as we know, Natalie, when you are talking about cancer screenings, the earlier you can catch it, the better. The pandemic has definitely led to many people putting a pause on these screenings. And that's really a big point for folks to take away here. As Dr. Kamal put it to me, a 2-year pause can easily become a 3, 4, 5-year problem. Back to you.
Doctors' offices have been up and running for 2 years, so people can get their screenings for sure. Lindsay Thies reporting from San Francisco with this eye-opening story and study. Thank you, Lindsay.